Doctors have a busy schedule. Your main responsibility is to diagnose medical issues, but it is also an important responsibility to care for the patient's overall health. This includes being observant of signs of domestic violence and acting sensitively and appropriately. The following video will offer useful information on the assessment of domestic violence, mandatory reporting requirements, and referral and engagement strategies. Step number 1, assessment. What are some signs of possible domestic violence? During your time with a patient, you may notice physical indications such as lacerations or injuries to the facial area. Bruises, especially those on protected areas of the body or in the shape of objects or handprints, are also signs of possible abuse. Behavioral cues, such as nervous or inappropriate laughing or smiling, anxiety, or lack of eye contact. Or verbal cues, such as minimizing the seriousness of injuries, talking about a friend who has been abused, or expressing helplessness or hopelessness. If you notice any of these, or you just have a feeling that something is amiss, use the following steps as a basic guide on what to do. Step number 2, mandated reporting procedures. Inform the patient of limits on confidentiality and your obligation as a mandated reporter. Healthcare providers are required to make a report if they provide medical services to a patient whom they suspect is suffering from a physical injury due to a firearm or assaultive or abusive contact. A telephone report to a local law agency must be made immediately or as soon as practically possible, and a written report in the form of OCJP 920 Suspicious Injury Report Form must be sent within 2 working days. Failure to report suspected domestic abuse is a misdemeanor crime.
Before we go further in our visit today, I want to share some information about our confidentiality policy. The information you share during this visit will be generally confidential, but in some situations, we are required to follow some reporting procedures. This includes if you have a plan to hurt yourself or others, a situation related to elderly or child abuse, and if I'm treating an injury or physical harm caused by other people. We cover this policy with all our patients during their visits. We want you to know that we respect your privacy, and we want you to feel comfortable with the information you share with us because we know it's very personal.
Reframe the situation and help the patient understand that your role is beyond just reporting.
Reporting is just one of the requirements of my profession. I'm here to help you.
If applicable, also assess for child abuse. The medical provider is also a mandated reporter to the County Child Protective Services. If the patient discloses any information that suggests a possible child abuse situation, the medical provider is required by law to make a report within 36 hours. Step number 3, do your best to make the patient feel comfortable to share. It can be extremely difficult for domestic violence victims to disclose anything about their situation. They often feel fearful that their safety will be threatened by sharing with anyone. Take the following steps to encourage the patient to share openly about their situation. Express your concern for the patient's well-being.
I'm concerned about you. How did this injury happen? I'd like to know more about it so we can prevent you from future injury.
Tell the patient about the negative impact of the cycle of violence.
Many women are suffering from an abusive situation and don't know they have options. There are many types of abuse that women can experience. Any type of domestic violence is not only affecting you as an individual, it also has a negative impact on your family and children. You may find yourself forgiving him over and over, but if you're not taking any action to change the pattern, the situation will not change.
You also want to validate their concerns and show empathy and compassion.
I understand it's truly a difficult situation that you're facing, and your concerns are reasonable. It must be stressful at home. Despite facing all those obstacles in life, I'm glad you shared with me about the problems you're going through.
Step number 4, empower the patient about their options. The next step is to empower the patient about their options. You can start by letting the patient know that others have benefited from seeking help.
I've seen many other female patients in similar situations as yours, and with the help of the behavioral health clinician and other agencies, these women have positive changes in their lives.
Provide resources and referrals.
I worry about your safety, staying in an unhealthy relationship. You don't have to make any decisions now, but it's an important decision, and I want to just share some information with you so that you know there are other options. There are many organizations in the community that can help provide information and support.
The next step is to discuss safety planning, using the safety card as a resource.
This is a safety card that contains important information for you, such as how domestic violence affects your health and organizations that can help you. Just be sure to read it in a safe place. If you're scared someone will find it, just throw it away, but try and remember the important information. We have a behavioral health clinician at our clinic available if you have further questions or concerns. Here's a contact information card. You're welcome to talk to me at future appointments.
Let's recap what we just covered. There are some simple but very important steps in caring for a possible victim of domestic violence. Remember, there are many factors which prevent someone from immediately disclosing that they are in an abusive situation. For medical providers, the steps are: 1. Assess signs of possible abuse, including physical, behavioral, or verbal cues. 2. Inform the patient of your obligation as a mandated reporter. 3. Do your best to make the patient feel comfortable to share. 4. Empower the patient about their options. You are in a position to potentially help a patient get out of a seemingly hopeless domestic violence situation. Your ability and willingness to assess an abusive situation and to take the necessary steps can mean a world of difference for a victim.